Implant prosthesis. How do we clean implant prosthesis? So what do we mean by implant prosthesis? We have a dental implant which replaces the missing tooth root, and we have a crown on top of the dental implant, which is basically called a prosthesis or the artificial tooth replacement. The common question is, when it comes to our natural teeth, we have different methods by which we clean. Of course, we do a cleanup, we use flossing, interdental aids. There are multiple methods by which we clean our teeth. But when it comes to implant processes, a common question that is asked is, should we remove the implant bridge from the implant and clean it and then fix it back to the mouth, or can we just clean them as like natural teeth, by using a conventional methods of dental cleaning methods? So we will answer that particular question in this video. Hello, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Namalipuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to Pearls Dentistry. We have a whole bunch of videos on dental education and awareness. So when it comes to dental prosthesis, implant prosthesis, what we need to understand is the mechanism by which the prosthesis is attached to the implant. That mechanism can either be removable in nature or fixed in nature. When it is removable in nature, we can have 2 or more implants. Those implants can be connected by a bar, and the denture can sit on top of those implants or on top of those bar. When in such a scenario, we can always take the denture out and clean it like we usually do for a removable appliance. But when it comes to fixed, it means that those teeth which we are replacing gets permanently fixed to the implant. So now question is, should we remove it to clean it? Now what we need to here understand is, what is the mechanism by which the prosthesis is attached to the implant? So now this will determine whether we need to clean it or not. When we have a conventional implant, say we have 6 implants in the lower jaw, and we have abutments which are the connecting link between the tooth and the implant, which are connected to the implant, and we have a bridge made on those implants. It means that the bridge or the prosthesis is resting on the implant inside our bone. In such a scenario, those processes should not be removed from the mouth. We can use any conventional cleaning methods to clean the implants, to clean the bridge and keep them clean, like scaling, like a flossing, or like a water flosser. We can use those conventional methods to keep those implant and the processes clean. But when we use something called the multi-unit abutments or hybrid processes on multi-unit abutments, it means that we have an implant, and top of the implant we've got something called the multi-unit abutment, which projects outside the gum. And then on top of those multi-unit abutments, we have a hybrid processes. That is, it replaces not just the tooth, it replaces the tooth and the missing parts of the bone or soft tissue that sits on the multi-unit abutments. So these are typically called abutment level processes. So these abutment level processes can safely be taken once in 6 months or once a year, taken out. Those abutment level processes can be cleaned, and the same processes can be fed back onto the patient's mouth. So what we need to understand is whether these processes is sitting on the implant or at the level of abutment. If it's on the implant, no need to take them out. It's not advisable to take them out, but if it's sitting on the abutments, on the multi-unit abutments, it is perfectly safe to take them out once in 6 months to a year's time to clean and then put that back in. Hope you like this video. Please do hit the like button. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.